Hi, I'm Virginia from Right Clinic, and here with me today is Andy Goldman. He is the copywriting physio, and he's a freelance copywriter with special interest in health and social care. And he also does triage referrals from hospitals, GPs, and social services, amongst others. And you can reach out to him on LinkedIn if you want his services. So I actually met Andy in person last year in September when there was the MedComs event. So it's lovely to have you on the podcast. And thank you so much for being here today.
No, thank you for inviting me. Really looking forward to it.
Yeah, it's a pleasure. I love it when I find a medical writer that's like super, super niche, because I would like pharmacy and medicines and you're with like physiotherapy, and I love my physio, and like we're very much like a physio first family. So,
Good. We like to hear that.
yeah. Okay, so what do you do and how did you get into it?
So yeah, as the name I've taken on, this Copywriting Physio. I claim that name because doesn't seem to be many of us out there, certainly not in the UK anyway, that I've seen. So I thought I'd get in there first and try and make it sound as simple as possible to hopefully let people know what I do. So yeah, Copywriting Physio. Quite simply, I'm both. So I'm a copywriter, but to stay up to date, to stay in touch with my audience, I still do a bit of physio. So that's I do a bit for the NHS, as you've said. So I do triage for the NHS at the Leeds Community Healthcare NHS Trust. That's alongside the district nurses, and we take referrals, as you say, from hospitals, GPs, social services, trying to keep people safe at home. So I continue to do that because it keeps me, as I said, keeps me up to date. I also do a bit of private work, so I keep my clinical skills up. So I have a few patients here and there. It's not my business. I do that for someone else. I can't. Otherwise it's just too much. And the rest of the time, I'm a copywriter. So writing for businesses on their websites, social media, blogs, you name it.
Amazing. And so when did you start getting into the writing scene, and what made you get into it?
Well, I'd be lying if I said it's something I've always wanted to do and have a career, because otherwise I've done that 20 years ago. So, well, as I said, I used to keep a diary when I was a teenager. I never wanted to show that off. I'm no Adrian Mole. I mean, I was 41 3/4 when the penny dropped, and I thought actually I could make some money out of this. So at my previous NHS trust, I created a Twitter account for the therapy team, so for the physios and occupational therapists. It was for our staff. It was to promote our service, but I also shared some patient experiences on there, which incidentally got the best engagement. The things that were showing all the positive stuff that we do, and how much the patients have improved, how much they enjoy it, and how our input does make a difference. It was quite a creative. I did it in quite a creative way. I used some video in there to promote things like Occupational Therapy Week or Allied Health Professionals Day, and it did really well. But I was just doing it for fun. I wasn't a paid role. It was alongside my full-time job as a physio, but I really enjoyed it. Moved on to the Leeds Trust. I didn't get so involved in that. There was far too much to do for me to do that as a side, so it kind of went on the back burner. But then I started doing something else. I started writing some articles for a men's mental health website. So, but again, it was all for fun. It was just things that I found interesting. I thought the men might resonate with, and as I say, then the penny dropped about 18 months ago now, and suddenly realised that I could actually make a living out of it. So it was a conversation with someone who works in an agency. I mean, it sounds really obvious now, but if I write something that someone else needs in their life, but I can explain it in a way that they can understand, I can make a career out of that, and people will pay for that service. But to do that with I needed to practice. So I reached out to family and friends in their businesses, and it was a bit of everything. I mean, what did I write for? A Caribbean restaurant, a horse riding training. It was a show jumping training, an accountant, kids' craft boxes, anything to get the practice. But the plan was always to go to an agency after that. But then, for whatever reason, that didn't happen. I left my job in the NHS because I felt confident to try and take this on. But then freelance is the way it went, because my work-life balance just improved absolutely tenfold. So I had to go down that route.
Amazing. So what would you say are the kind of top advantages of going freelance?
Oof. Well, straight away, I've got one little girl. She's 10 years old, and where I was working in the NHS, it felt like the job didn't stop. I'm sorry, it's just how it felt. And at times yeah, it was because I couldn't be there to say do a school run or have to ask permission to go to her sports day. I don't have to do that anymore, and I suddenly realised that if I can make this work, and it was a calculated risk because I want to keep my registration. I think that's really important to me. I don't want to waste that. So being able to have the comfort that I can still bring some money in because I've still got to live, but still be able to do all the things I want to do for my family and see my little girl at this age now. There's no point me working really hard, say for the next 8 years and doing what I was doing, and then she leaves home and I miss all that. So the absolute advantage of this is I get to spend more time with my family, but still work probably more hours than I was doing before, but it's more fun.
That's really sweet. And I love that even though it's more hours, you get to choose those hours.
Yeah.
And then for the other hours that you're not working, you're actually doing what you want to do with those hours. Whereas before you'd have a schedule and your time would be kind of chosen for you. And that's been one of my frustrations when I was an employee, whether it was a pharmacist or as a writer. And I could totally relate because life is so different as a freelancer.
Yeah.
And overall, you might work more hours, but I think you get more experience, you get more enjoyment out of that, you get to pick who you work with, and you also get to do the things that you want to do when you want to do them, within reason. Obviously, I mean, if you can take 3 months off in a row, why not? You know?
Oh, I don't know about that, but yeah. But no, it's nice to have that. It's nice to have that choice, like you say, and I might be working more hours, but at times it just doesn't feel like work because it's really some of the things I'm doing is really fun to do. I really enjoy the writing. I love the networking has been a big thing as well from the start because when I first got into this, I went down the freelance route. I realized I don't know anyone. This isn't just writing. At some point, I'm going to have to market myself. I might need a brand. I need all this stuff that I know nothing or knew nothing about at the time. So as much as I'd done all my homework and read the books and how to write copy, it wasn't enough. So it's taken a bit of time. So I only joined LinkedIn just over a year ago, and I never really needed it in the NHS because NHS jobs was my go-to for moving on through my career. But it's very blinkered, isn't it? But joining LinkedIn for the first, say, 6 months, working out who I was and what sort of copywriter I wanted to be, I didn't feel like I had the authority or the credibility to just come out and start giving out tips or to know what I was talking about or anything like that. So I built a network of people. I waded through the ones that, actually, no, I don't really, I need to find my people. And gradually I've been able to do that, yourself included, Virginia. And there you go. And then around last summer, from the people I was networking with and talking things through and working out who I wanted to be, that's when I decided I need to niche in healthcare. I mean, to begin with, I didn't want to touch healthcare. I got to the point where I'd had enough. I just needed to do something else for a while. And I enjoyed looking at all these different businesses, different areas, and it's fun. It's fun researching these things, and you're learning things every day doing it. But my credibility and my authority in an area is around health and social care because that's been my background as a physio. I'm not your classic MSK physio. I worked in the community, so I see people in their own homes, and it's very much about quality of life and improving function and keeping people safe and making sure they've got the care that they need. So I wanted to try and bring that to my writing. So
amazing.
I've continued to build that with LinkedIn. I think people are recognizing who I am now. Well, so people say. And the Copywriting Physio, it's nice and simple. It says both of the things that I am.
Amazing. And yeah, I've definitely seen you pick up LinkedIn kind of from being tentative about what to post, and now your character comes through your posts as well, even posting about your cat.
Yeah, well, she wasn't very well, and she lost. You may or may not have seen it. She lost an ear. She had surgery to remove her ear. She had a tumor inside her ear the ear couldn't be saved, unfortunately. But no, she's fine. She's alive and well, and probably screaming to come into this room at the moment. But I'm not letting her steal my thunder.
I mean, she was invited, so
she was, but I'm being selfish.
That's okay. It's okay. The cat maybe next time.
Maybe next time. She might need to book her own slot. It's
It'll just be me and the cat. The copywriting cat.
Yeah. I spend so much time marketing myself. I can't do her as well, so she's going to have to do it herself.
It's true. Or you need to get her an agent to do it. Big business.
Maybe I need to go into that business as well, and I can charge a fee for it. We'll see.
Yeah, exactly. Let me market your cat or your dog, your pet. It's a thing. I'm sure it's a thing.
Oh, definitely.
Yeah.
If not, I'll make it a thing.
So what would be your top tips for someone who's trying to switch from a clinical career into writing?
If you know that you can write and make something sound eye-catching, or it grabs attention, and that's great, and you can learn all those skills. But the biggest thing I would say is the skills you already have are very much transferable. So being able to communicate, able to listen to your patients or clients, and being able to translate that into writing. I mean, you as a clinician, you're doing probably doing it every day anyway when you write your patient notes. Certainly in the area I worked in, it's very much a multidisciplinary team. So I can't use jargon. Even in that, I can't abbreviate. I have to write it because of my audience are other nurses, GPs. I mean, they need to be able to read what I'm writing. So if anything, I've been doing this for many years anyway without really realizing. So my top tip is that you've probably got a lot of the skills already there, and writing is a skill, but the emotion, the feeling, the things you want to resonate with your audience, you've already got it, and you can transfer those across. And if you can work, but again, with the writing, it's practicing and it's doing something every day, even if it's keeping a journal. It took me time to then put it out there, but as I said earlier, once I got around to posting more regularly on LinkedIn and building a network of people who are really, really supportive, and you find the people you want to hang out with, it makes it all worthwhile. And you really enjoy it. And I mean, LinkedIn is a networking tool as such, and a promotion, to trying to promote my business. But it's also, you find friends on there and work colleagues that you want to spend time, chatting to and learning from.
Yeah, amazing. Thank you so much.
Okay.
So what's next on the horizon for you?
What's next? Well, as I say, it's taken time to get to this stage. I wanted to get my website right. I wanted a brand, a logo. I've got those things in place now because I wanted to look. Just with me, I want to look professional when I start pitching to businesses and looking for clients. So I have got clients starting to come through or approaching me, and I need to do more kind of on the outbound side of things as well. So because of the way I work with physio, I can sliding scale. If I've not got enough writing work in, I can start doing some more clinical work. But when I get more writing work, I can start moving it the other way. And I want to get more writing work now because I feel like I can have, maybe a bigger impact with writing because I can capture more people doing that. So I'm available now for work for, as I say, for websites. It could be social media posts, blogging, article writing. I'm available now. So if anyone wants to get in touch with me, I'm happy to have a chat about it.
Amazing. Thank you so much. I'll leave links, of course, to Andy's LinkedIn in the description below. So do reach out. He's very friendly, very nice. And I'm sure he's got a wealth of experience and you can trust what he writes, especially if it's got to do anything physiotherapy related or occupational health as well. So thank you for your time today, Andy.
No, thank you. And thanks again for having me on.
Yeah, no worries. And I'm sure we will be back on here again, maybe in a year's time, to see your progress. So I'm really looking forward to that.
Oh, I hope so. Yeah, that'd be great. I'd love to do that.
All right. Well, good luck with everything, and I will catch you soon. Bye.
Thank you. Bye.